Good evening, everyone, and welcome to our very special Young Adult webinar series. My name is Brian Thompson, Programs Manager for Can Do Multiple Sclerosis. And thank you for joining us for part 2 of our Young Adult series. Tonight we'll be looking at staying active in an unfamiliar body. Thank you to our presenters, all of our sponsors for supporting this Young Adult series, and of course to all of you for joining us either live tonight or watching our archive recording. I'm thrilled to introduce our two speakers this evening. We have Alex Ng, who's a professor at Marquette University, and a familiar face to many of you, Mandy Rohrig, who is a physical therapist and the senior programs consultant for Can Do MS. So I'm going to go ahead and turn things over to Alex and Mandy. Good evening.
Good evening.
Hi, everyone. Thanks, Brian.
Thanks, Brian. So, as Brian mentioned, I'm Alex Ng. I'm an academic exercise physiologist at Marquette University. I've been studying MS for about 25 years, and I teach and have a research lab, and I'm really pleased to be here tonight.
We are glad to have you, Alex. My name's Mandy Rohrig. I'm a physical therapist in an outpatient physical therapy office in Omaha, Nebraska. I've been working with people who have MS for 13, almost 14 years now. So I'm really excited to be with all of you this evening. And Alex and I are really excited to be able to work together on this. So thanks for joining us.
Always a pleasure, Mandy.
Here are our learning objectives. Participants and support partners will understand the relationship between exercise, physical activity, and rehabilitation. Understand the potential benefits of exercise and physical activity on the immune system, brain health, physical function, and prevention of other health conditions. Be familiar with the key components of an exercise program, and we'll go into all of those more detailed. Identify and problem solve common barriers to exercise and physical activity. Learn how to personalize exercise and physical activities as symptoms can fluctuate. And lastly, become familiar with some adaptive exercise options. So we have a lot of ground to cover this evening. So we're going to start with a really broad bird's eye view. Your movement prescription contains 3 kind of buckets, if you will. The first bucket is physical activity. Exercise is the second one, and rehabilitation is the third. These buckets can become, and circles can become larger or smaller, kind of based on your own personal needs, and also, I would argue, where you're at in your disease.
Thank you, Mandy. I want to talk a little bit more about these buckets, so to speak. That's a good way to describe them. And physical activity is basically any type of muscular movement, or even a muscular contraction. It doesn't have to result in movement that expends energy. So this would involve a lot of the exercises, a lot of activities of daily living, leisure, just kind of living. It tends to be unstructured, so it can happen spontaneously. It can actually include exercise, and I'll talk about this a little bit more. But the key thing here is that it's unstructured. Exercise, in contrast, is highly structured. It's often prescribed. The prescription can be from an exercise physiologist, physical therapist. There are other clinicians that also have expertise in exercise, a nurse practitioner, and OT. And in fact, where I am in Milwaukee, we have a fellow that just kind of started up an MS gym and learned through trial and error with the help of some physical therapists as well. So just look and make sure that the person knows what they're doing. They're trained in exercise and has some experience with people who have MS if you're looking for a provider. It is highly individualized. So the prescription, it's not a one prescription for everybody, and we'll talk about this more. And the prescription can evolve based on how much you're improving, or if you're overtraining, or maybe you're trying to do too much. The exercise can be prescribed to improve fitness, or function. It can also be prescribed to improve health or what we call wellness. And it is performed on a consistent basis. So we can describe it based on how many times per week and this principle that was called the FIT principle, and that's the basis of exercise prescription, and we'll talk about this in more detail. Mandy's a physical therapist, so I think she should probably talk about the next bucket.
So, excuse me, rehabilitation differs from exercise and physical activity because it actually can contain both exercise and physical activity. A physical therapist, an occupational therapist, or even a speech therapist, among other healthcare providers, can provide exercise and physical activity recommendations. But rehabilitation is different because it's used at different times over the course of your disease. So, for example, it could be used at diagnosis to establish baselines and just kind of find out where are your abilities and where are those areas that need improvement. It can be used during relapses or after relapses to allow people to regain function or to learn ways to compensate for lost function. It can also be used with disease progression or changes. I personally like to call these tune-ups. So these are those times when, maybe there's no disease activity on the MRI, but you just kind of feel like either you're losing interest in your exercise or you just feel like things aren't moving as well as you would like. You can come in and receive a physical therapy or a rehab consult for a tune-up. But regardless of at what stage of your disease that you decide to access this care, there's usually a very distinct beginning and a distinct end. That's a requirement for most insurances to provide physical therapy and occupational therapy for that matter. And there's a very strong emphasis on goals and maximizing function. So your therapist will always talk to you about setting goals and working towards those goals, trying to show progress. It's, again, very function focused because at the end of the day, we really just don't want you wasting valuable energy on exercises or activities that aren't helping you optimize your function and mobility. And now Alex is going to talk to us a little bit more about this difference between each of these and the relationship.
Yeah, thanks, Mandy. As you mentioned earlier, we can look at these as buckets, but sometimes the buckets intermingle. And to a certain degree, I don't know how important it is to distinguish between physical activity and exercise. It's fun for academic debates, but from a practical sense, physical activity and exercise are we can think of them as synonymous. But if I did want to debate it, we could describe, again, physical activity as any muscular contraction. So because of this, when we exercise, this often involves muscular contraction. So all exercise is physical activity. However, not all physical activity is exercise. Exercise we need to make time for. Physical activity could occur spontaneously. And then rehabilitation, in many respects, could be considered a part of an exercise because it would be prescribed, something that a person would be told to do a particular exercise so many times per day or for a certain period of time. And like you mentioned, it would have a particular end. So if we wanted to think about physical activity, exercise, and rehabilitation that way, we can. But again, remember, physical activity and exercise, we can think of them as the same. So with respect to the benefits of physical activity and exercise, and I think this is really important because physical activity does have particular benefits for people with MS that might be specific to this disease as opposed to just general health consequences for everybody. So I want to talk about the potential role of exercise and physical activity in multiple sclerosis. And one is that it can result in functional benefits, so improved fitness, improved strength, decreased muscle fatigue, perhaps decreased, MS fatigue, if you want to call it that. Balance can improve, bone density can improve. So bone mineral density tends to be decreased in persons with MS. So physical activity or exercise can improve bone density, there is more and more evidence that exercise can improve or help maintain cognition. Some of this comes from my own lab. So there's a lot of things to be said for why we would want to exercise with respect to physical function, fitness, or even some of the symptoms of MS. There's some really exciting new research looking at brain health and whether or not exercise can affect the immune system. So, with respect to brain health, there's several neuroprotective molecules that are produced through exercise. One is called brain-derived neurotrophic factor, or BDNF. I would say the research is not consistent on this, but when we exercise, muscles do produce this substance, and it can travel to the brain, and it may help with improved brain neurochemistry. There's increasing evidence that exercise may in fact affect the immune system. As I think most of you probably know, MS is an autoimmune disease, and there is a tilt or balance, if you will, towards inflammation in the body. So what exercise can do is it can kind of tip the balance of particular chemicals produced by cells so that we have less inflammation and perhaps more anti-inflammation. So that's becoming more and more accepted with respect to MS. So this could actually affect the course of the disease. So taken together, we can see that MS can attenuate the disability or any disability, and regardless of whether you have MS or not, it can certainly enhance quality of life. I talked about some of the potential benefits of exercise specific to MS, and there's a kind of a theory that's out there now that exercise and physical activity may in fact be a disease modifying treatment. So just as you may be on your pharmacologic or drug disease modifying treatment, exercise may also affect the course of MS. There is some evidence, and let me tell you right now, this is not proven by any means, but the idea is out there. And the thought is that exercise could help decrease relapse frequency. It can certainly decrease mobility, disability, and aid in mobility progression. So exercise definitely has an effect on gait and ambulation. With respect to neurochemistry, there's some evidence that lesion volume, as seen on an MRI, can also be decreased. And on top of all of this, so this is bonus, exercise and physical activity can certainly influence comorbid health conditions that may worsen symptoms and hasten the disease progression. So what are some comorbid health conditions? Well, these are the things that everybody worries about, regardless of whether you have MS or not. Cardiovascular disease, hypertension, obesity, diabetes, cancer, lung cancer, breast cancer, colon cancer for sure, maybe maybe prostate cancer. So these could all be comorbid health conditions. And if you think about it, it's not like exercise is snake oil. There's actually evidence to support a lot of, well, everything that I've said. And it's like exercise is really a miracle drug. And we're starting to think of exercise now as medicine. And so you may hear that term that exercise is medicine. And if we could actually take this in a pill and sell it, then Mandy and I would be rich. And, well, we wouldn't be around here. We'd be off on some island with our families or something.
So Alex did a great job of introducing the concept of comorbid health conditions. This is something that we can focus on and that you all can do today. You can do right now, today. It's not like a disease-modifying therapy that has an impact that we can't necessarily see immediately, but it has an impact in the foreseeable future. But comorbid health conditions are those medical and mental health conditions that exist in addition to multiple sclerosis. And the good thing is they are modifiable and manageable with wellness strategies. So they can be treated and managed and worked with diet, with exercise, with working with your primary care provider and finding those medications or those other wellness strategies, stress management strategies, whatever the case might be, to help manage those conditions. Depression and anxiety, diabetes, high blood pressure, high cholesterol, and chronic lung disease are those conditions that are most common in MS, and they generally are vascular conditions. So again, those strategies, including diet and exercise specifically, can help to influence those conditions, which in turn can influence not only your health, but potentially the disease itself. So Alex, if we want to take charge of MS and take charge of these comorbid health conditions and really take advantage of all of these great key points that you've brought up already about brain health and immune system health, what do we need to do? What do we need to do to take advantage of these benefits?
Well, I think that's a great question, Manny, and I think the overriding consensus right now, and I'm sorry about these echoes. I'll see what I can do about it as we progress. So if you see me fiddling around, that's what I'm moving for. And speaking of movement, so the movement prescription is about 150 minutes of moderate intensity exercise or physical activity per week. And I'll describe moderate a little bit later on, but this is really the overriding prescription. Many of you may already be thinking, whoa, 150 minutes, how on earth am I going to do this? So Manny, do you have any suggestions for how to get started?
Yeah, I think Alex brings up a good point. Like, how will you get your 150? How does thinking about 150 minutes feel to all of you? To some of you, it might feel, oh, well, I'm actually maybe achieving that already. I participate in regular exercise and I walk the dog. But to others, it might feel more like this image. It might feel like the staircase. It might feel like the staircase that never ends. It might seem like a very unachievable goal. And I think what's important as our primary takeaway from this webinar tonight is that all of you can achieve exercise and physical activity, and you can incorporate it into your lives regardless of where you're at in your disease. And you can reap the benefits of what Alex has described, even if it's just increasing how much movement you do from where you're at today. So any movement counts. Any movement is better than nothing. So let's dive in a little bit into the first bucket, or the first part of your movement prescription, and this is exercise. So exercise essentially has 4 components. First component is flexibility, strength and endurance training, balance and coordination training, and lastly, cardiovascular aerobic exercise. And we'll dive deeper into each one of these components, more specifically addressing these principles, these categories, or this prescription. And that's what Alex mentioned earlier. It's something we call the FIT prescription: frequency, intensity, time or duration, and then type or specificity of exercise. So how often should you exercise? How hard should you exercise? How long should you exercise? And then what types of exercise are most appropriate for you? So this next image, it's a busy one. So what I actually want you to do is print it off and stick it on your refrigerator, or on your bathroom mirror, or someplace where you see often, because it's a nice slide that summarizes all of the current recommendations and guidelines for people with MS as far as exercise prescription goes. So again, this is a nice summary slide. We'll dive a little deeper into each one of these sections moving forward. So we'll talk about flexibility first. Flexibility is used to help manage spasticity. So it's exercises and activities to try to improve range of motion. Spasticity, for those of you who aren't familiar with spasticity, is a velocity-dependent or a speed-dependent resistance to movement. So it can feel like true muscle spasms. It can feel like tightness. It can feel like heaviness to some people. It can be very constant, or it can fluctuate day to day, hour to hour, even minute to minute for some folks. Triggers for spasticity or irritants of spasticity might be bladder. If you have a really full bladder, that can make your spasticity in your legs much worse. Or same thing if you're constipated or having some bowel issues, that can impact your spasticity as well. Similarly, if you're having an upper respiratory tract infection or any type of infection, that can impact spasticity as well as all of your other MS symptoms. So just be aware of those other issues that can contribute to your movement. But here's the outline of the current recommendations for flexibility. This is just a guide, so please understand that it's important to talk with an exercise specialist, exercise physiologist, physical therapist about what are the appropriate recommendations for you and for your situation. So frequency, daily, intensity, repetitions, 2 to 3 ideally, and that's for each muscle group, holding anywhere from 20 to 60 seconds. And you can do this both individually or with a partner. And actually, the National MS Society has a really great resource. It's called Stretching with a Partner or Stretching Independently. There are 2 brochures that you can go online and print those off if you would like, that give you some good comprehensive stretch positions and stretching activities. But let's move on to strength training. Tell us a little bit about strength training, Alex. Let's see those muscles. Let's see those
yeah, if you could see my arms, you could tell that I don't do enough strength training. So here's what I really should be doing. And let me back up a bit. So when we talk about strength training, you'll often hear this called resistance training. It's the same as what some people refer to as going to the gym or even weightlifting. So it's just they're all just fancy terms for something to improve or increase strength. So if we go back to the FIT principle, we can talk about how often should you be strength training. And the Canadian MS recommendations are for 2 times a week. So minimally, you should be aiming for twice a week. However, you can go 3 times a week. You don't want to strength train too much because in order for strength to improve, there has to be a recovery process. So you don't want to be strength training every day. Minimally 2 would be great. 2 to 3 would be even better. And what's nice about strength training is you can see an improvement in as few as 1 or 2 sessions. Never mind, even in just 1 week. And that's why for some people, strength training is really fun. With respect to intensity, and again, this is how hard it should be, you want to start slowly, and it would be helpful to work with someone on this. Again, an exercise physiologist, an exercise scientist in some other discipline, a physical therapist. In general, you want your progression to be slow, and you want to progress how many times you can lift a weight before increasing the amount of weight that you're lifting. So for example, you want to begin at, let's say, 8 to 10 repetitions, where a repetition is how many times you can lift that weight. So begin at 8 to 10, and then once you've done that, we refer to that as 1 set. So you want to start off with 1 set of 8 to 10, and then you can move on to 2 sets. You can progress 1 to 2 repetitions every 2 to 3 weeks. And then once you can do that, it may be it's a little hard, but you can do it pretty consistently. Then increase your weight by 1 or 2 pounds and start decreasing your repetitions from, let's say, 12 or so back into that range of 8 to 10. So optimally, you want to go 8 to 10. And you want to do 1 to 3 sets, and low end would be about 8, top end would be about 15. And again, you're a physical therapist or an exercise physiologist or scientist can certainly help individualize or prioritize recommendations and help you with your progression as well. One of the things about strength training is that with respect to health, we tend to think of most of the health benefits as coming from cardiovascular exercise. And I admit, I'm guilty of that. But to be honest, if I had to recommend a single exercise, and I don't do that because we know that flexibility, strength training, what we call neuromotor training, cardiovascular training, when taken together, all the buckets together, we know that there can be improvement in gait and in some of the symptoms of MS. So I think there's a natural tendency to lean more towards one or the other, but you really want to try and make sure you incorporate a little bit of all of these buckets into your activity regime. Now, having said that, if you're lacking time and you just really like to weight train, sure, you can minimize your cardiovascular exercise and you can emphasize your strength training. Now, the reason I wouldn't have said this 5 years ago, 10 years ago. What happens with strength training is it can improve bone mineral density. Just by increasing muscle mass means that you're able to better handle glucose or sugars. And so this decreases risk for type 2 diabetes, which used to be known as adult onset diabetes. So that is, I don't know if you're aware of this, but our nation is in an obesity and type 2 diabetes epidemic. So strength training can also help with that. And believe it or not, there's actually a decrease in cardiovascular risk factors with strength training. So it's good. So it can be a good thing. And I'm certainly a convert, although if you saw me, you wouldn't know it. So,
can I add one thing, Alex?
Yes, of course.
I was just going to say, sometimes in the clinic, people, if they have a side that's more involved or less involved, I encourage people to, it's okay, I assure people that it's okay to do different weights for one side of your body or one muscle group than what you would do on the opposite side. Would you agree with that, Alex?
Oh, yes, of course. And in fact, I think in the next slide, we'll even talk about exercising to encourage function. Mm-hmm. And in fact, let's start with this. And certainly if you have, let's say, weakness on one side, or if you're having problem with movement on a particular leg or arm or hand, this is absolutely the time when you want to talk with a physical therapist or occupational therapist, because then they can give you specific instructions. It wouldn't even have to be in addition to your strength training regime. It could be, just some exercise that you do as part of that program. So if I go backwards, when we talk about strength training, in general, we want to, if we're talking about a general program, we want to be exercising the major large muscles of our body. So proximal muscles, strengthening emphasis. So, yep, you got it, the biceps, the quadriceps, calves, so all of the large muscles of your body. You do not have to have access to a gym. I know I mentioned gyms before. If you do, that's great, but you can use free weights at home, soup cans, milk jugs, elastic bands, as well as body resistance. With respect to time, okay, even though I said you want to do it twice per week, a lot can be completed in just one session or multiple smaller sessions during the day. And as we move on to our prescription with cardiovascular exercise, your strength training can be combined with that. So that way, it's not like you have to do exercise 4 or 5 times a week. You can do it 2 to 3 times a week. You do want to avoid excessive muscle fatigue. I mentioned earlier that in order to get stronger or to get a larger muscle mass, there has to be a recovery period. So with this in mind, during your exercises, you want to rest 1 to 5 minutes between sets, or you can alternate arm and leg activities. So an arm is recovering while the leg is active. And again, you don't want to be exercising the same muscle, every day during the week. Okay, one of the things that strength training is good for is it can also improve balance. And so I'm going to let Mandy take over from here.
Thanks, Alex. So in addition to treating folks who have MS, in the clinic I also work a lot with folks who have balance and vestibular issues. So this is something of great interest to me. So how balance works normally in our nervous systems is we'll talk about first. So there are essentially two systems that help with balance. The first system is our motor system. So this is both the musculoskeletal piece of the motor system, but also the neuromuscular. So the musculoskeletal is having sufficient strength and flexibility, which we spoke of, to be able to sustain your balance. The neuromuscular component is having the proper coordination and timing of the muscles to fire to help you recover from a loss of balance or to sustain your balance. So that's the motor system. That's part one. Part two is the sensory systems. So the sensory systems contain three. Your eyes, so that's your visual acuity. This is your ability to see your world, move around it, adjust as you need. Your inner ear, which is actually positioned behind your external ear itself. And it's kind of in that bony prominence. If you feel behind your ear, you'll feel kind of a bony prominence back there. That's where your inner ear is housed. And what your inner ear does is it interprets rotational movement as well as translational movement. So rotational movement is if you turn your head or if you're turning your body. That translational movement is if you're moving horizontally or if you're moving, excuse me, vertically, like in an elevator, for example. So eyes help with balance, the ears help with balance. The last system are the muscles and nerves in our legs. And actually, I want to back up to the inner ear. I want to tell you a little bit more about that. So as the inner ear itself interprets these movements, does that make you dizzy? As the inner ear interprets all of those movements, it communicates with our brain and then our eye muscles through a reflex called the vestibular ocular reflex, or the VOR. That vestibular ocular reflex is very quick. It's just like other reflexes in our bodies. And what that does is it allows our vision to stay steady as we're moving around. So often what I hear in the clinic, if, say, for example, there's something going on in the vestibular system, whether in the inner ear or somewhere in the connections within the brain, people often complain of like a bad home movie sensation, or they have trouble focusing when they turn their head. It's kind of like a whoosh, and then it takes a second for things to focus back in. That would be suggestive of maybe some inner ear involvement. So as I mentioned, eyes help with balance. The inner ear helps with balance via that vestibular ocular reflex. The last system is our somatosensation, or that ability to touch and feel the ground, feel our feet, and have an awareness of where the position of our joints, and have an awareness of where our body is, and have that message be sent up to our brain to communicate about where our balance is that way. So we have these three sensory systems that give us good input to the brain, and then the brain processes that and gives it out and via the motor system, so good motor output. So I think a good way to show how this works is if, say, for example, you get up in the middle of the night to go to the bathroom. It's dark or dim light, so you can't use your vision as well for balance. So those other two systems that we spoke of, the inner ear and the muscles and nerves and feet, have to work a little harder. Let's add MS to the mix. If you can't use your eyes as well for balance, you have numbness and tingling in your feet, say, for example, then that really puts a lot of stress and a lot of extra effort on the inner ear in order to sustain your balance. So it's really, really important, if you're someone who has balance issues, to talk with your rehab team. And what your rehab team will do is a little bit of detective work to see what systems need work, what systems need more attention. Maybe there are things that we can do to compensate for situations that are challenging. So again, this is highly variable, highly individualized because of everyone's different circumstances when they feel off balance. So there are lots of ways that we can challenge balance. They're listed there. Cushions and Swiss balls and weights and torso weights in particular to help stabilize or change your balance. Vestibular exercises, I want to bring that to light. So vestibular exercises are exercises that specifically target that vestibular ocular reflex we talked about. So they might look like exercises like this, for example, where you might focus on a target. If my thumb's the target, and you'll keep your eyes on the target and you'll move your head side to side. And you would do that in progressively challenging postures, say, for example, sitting, and then you would progress to standing, and then you would maybe do that in walking. But certainly if you're someone who feels like you might have a little bit of a challenge related to your inner ear, talk with a therapist, see if some vestibular exercises might be good and helpful for you. So that's balance. We've talked about flexibility, strength, balance, and Alex, take us away with cardiovascular.
Sure thing, Mandy. So cardiovascular exercise has many different names. Some people refer to it as cardio. I grew up with it as aerobic exercise. It doesn't really matter what you call it. It's some people call it endurance exercise. And this is the exercise that's probably been most associated with decreasing cardiovascular risk and increasing functional capacity. Although again, I would not minimize the influence of strength training. So if we stick with the FIT principle, the frequency of cardiovascular or cardiac exercise should be 2 to 3 times per week, 2 to 5, and all of these recommendations that we've been giving you are to be considered minimal. So if you have a difficulty, if you're not there yet, then this can be a goal. If you're already doing more than what's recommended, then that's great, and keep doing it. So it does not mean that you should back off what you're doing. So let's say 2 to 5 sessions per week, we can average around 3. What about the intensity? Okay, what we want here is what we call moderate intensity exercise. So there's several ways to determine what moderate is. One is the so-called talk test. So if I'm going to use the example of walking, jogging, or running. So let's say you're walking and you're able to carry on a conversation with someone pretty easily. Then this would not be moderate. And let's say you break into a jog or you go a little faster, and now you're talking, hey, Mandy, what's going on today? Oh, I don't know, Alex, just kind of hanging out here. Okay. So you're able to carry on a conversation, but you're a little short of breath, but you probably could not sing. So you could sing at that lower intensity. Now we break out into a run. Hey, Mandy, what's up? Don't know. So when you're kind of more communicating as a grunt, this would be your high intensity exercise. Now it could be that you're walking and you're, hey, how's it going? I don't know. Ask Brian. Then that could be your high intensity exercise. So this is highly individual. There is no one size fits all. So that's one practical, easy, quick way to determine intensity. A popular way that is still being used is to look at intensity as a percentage of what we call your maximal heart rate. Now, usually we have to estimate maximal heart rate unless you had reason to do a maximal exercise treadmill test. Most people have to estimate it as 220 beats per minute minus your age. There's a huge range. There's a lot of error in this. Now we take 60 to 85% of this maximal heart rate range, and this should be your optimal exercise intensity for moderate. 60 to 85% of your maximal heart rate, where your maximal heart rate is 220 minus your age. So I've already kind of hinted at my bias that there can be a lot of error in the estimation of maximal heart rate. If you're on any cardiovascular medication or any medicine that affects heart rate, then this can also affect your exercise prescription. So the other limitation is that how are you going to measure your heart rate? Well, fortunately, there are some monitors that are fairly accessible now. such as you can measure your heart rate that way. I've seen some apps on a cell phone, but it takes some skill to do it by palpating your wrist or palpating your carotid artery. So there are a lot of reasons why maximal heart rate is not good, and there's also some people that suggest that heart rate is actually lower just because you have MS. So there's a branch of the nervous system, the autonomic nervous system, that can be affected in MS and can result in a blunted blood pressure response to exercise. So heart rate is not the best to monitor exercise intensity for if you have MS. What most people are now recommending, and there's at least 3 or 4 good papers out there in the research literature that suggest that a rating of perceived exertion can be a really good tool to monitor exercise intensity, really for anybody. So the rate of perceived exertion is a scale of 0 through 10, where 0 is nothing at all, or rather you're not exerting yourself at all. So when I'm just sitting here talking to you, this would be a 0. Now I may have difficulty sitting up straight, and I may be using some muscles there, but I'm not otherwise exerting myself. So that's 0. 10 is really maximal. So this would be, I mentioned a treadmill test. You're on the treadmill, it's speeding up, it's up a huge incline, and you're just about ready to get spit off the back. That would be your maximal. If you're holding on to a bar above an alligator pit, and it's not too bad at first, and then slowly you start, you're hanging on, and it's going, oh, this is pretty hard, very hard, and your 10 is just as you release and go down. So just before you release, that would be the 10. You're running up a hill to your house, which is burning, and your pets are inside. That would be a 10. So if you anchor yourself, you can actually use the scale really well, and you can see on the scale that there are labels too. So 3 is moderate, so that would be your sweet zone, let's say 2 to 4, somewhere in there, 3 to 5, and so that's what you want to work for. So it's a subjective feeling. I forgot to mention that. It's just a total sum gut feeling of how hard you think you're working at any given moment. So you could be at a moderate with slow walking, or maybe you're hiking with some poles. On the other hand, you could be on a recumbent bicycle, pedaling as hard as you can, and you could also be getting 3 or 4 on a recumbent bicycle. So it doesn't matter how you get it. So it matches whatever the type of exercise you're doing is. Okay, so continuing on with cardiovascular exercise, the duration is 10 to 40 minutes per session, or you can break it up into 2 to 50-minute sessions, so you can accumulate the time in cardiovascular exercise. You always want to warm up or cool down to avoid injuries, and it just makes the exercise a little easier. So this would be an RPE of 1 to 2 on that 0 to 10 scale. Your exercise zone should be 3 to 5 out of 10. What type of exercise is this cardiovascular? Well, it can be walking, hiking with poles, upright bicycling, recumbent bicycling. It could be road bicycling. It could be arm cycling. It could be boxing. It could be kayaking. It could be swimming. Swimming is an excellent excellent exercise for anybody, but particularly for people with MS. It can give support to your limbs, which may have some impairment. So it allows you to, for someone who may have difficulty walking, it allows you to walk in the pool because of the body weight. This would be another good reason not to use heart rate, because your heart rate is naturally lower when you're submerged. So, but swimming or aquatic exercise is really good. And if you have any type of temperature sensitivities, the water aids in cooling. So, one thing I want to leave you with is this. We do these exercises because we need to convince the medical community that exercise is good, or a particular type of exercise is good. But regardless, we would expect the same physiological responses to exercise regardless of whether we have MS or not. And as a result of that, we've now started to look at higher intensity exercise, or HIIT training, as it's sometimes called, where HIIT refers to high intensity interval training. And we now know that this is not only safe, but it can be recommended for people with MS. So this is high intensity. And people like to do bursts of high intensity. From my years of, helping people learn how to exercise properly with Can Do, invariably people want to start going faster. And this is okay. You don't want to be doing it for 20 minutes, but, you can even have a structured high intensity interval training once per week. So by this, I mean 90 to 100% of your maximal heart rate. Really, you're going all out, or an RPE of 9 to 10 on a scale of 10. Duration could be as little as 5 seconds. So what we lose, to make up for the higher intensity, we have a slower duration. So we really want to be looking at no more than 30 to 90 second intervals with an equivalent rest completed in one cycle of higher intensity interval training. It can be whatever you are using for your aerobic exercise, whether it be hiking, bicycling, kayaking, or swimming. There are perceived advantages and disadvantages of the HIIT training. So if you don't like it, there's no need to do it. If you're short on time, this is an excellent way to get in your aerobic benefits. Again, if you don't like going that hard, there's no need to do it.
So that's great. This is a lot of good ideas of how you could potentially get your 150 minutes of exercise or physical activity. But now that we've talked about exercise, let's go in a little bit into physical activity, Alex. So let's talk a little bit about that.
Okay, sure. Well, to begin with, I know the audience doesn't realize this, but there's actually a feed from their camera into at least my computer. I don't know if you could see them too, but the minute we started talking about 50 minutes a week, I could see a lot of eyeballs starting to roll. Ooh, that's getting kind of vestibular. And so you're going, yeah, right, 150 minutes a week. Well, let me tell you, again, these guidelines are goals. And if you can't meet the goals, you are still going to get a benefit of exercise. So from the ACSM 2011 guidelines, as well as from the U.S. Department of Health and Human Services, for all individuals, some activity is better than none. Further, adults who are unable or unwilling even to meet the exercise targets or guidelines outlined here that you and I have been talking about can still benefit from engaging in amounts of exercise or physical activity less than recommended. So, we started this talking about differences between exercise and physical activity. So let's talk about physical activity. Let's forget the structured, fit principled exercise and go back to the concept that any body movement produced by contractions of skeletal muscles that results in a substantial increase in exercise over resting levels is physical activity. So we can sneak physical activity into our day. And so any physical activity counts. You can, I know this sounds kind of weird, but you can park the car further away so that it takes you longer to get to where you want to go, or you have to be more active to get there. Whether you're rolling in a chair, if you're walking, or even if you're jogging, you can get forced exercise that way. An easy thing to do is stand during commercials on TV, or stand during the whole thing. There are standing desks. Unfortunately, a lot of us work in offices, and the late Jack Pettijohn once told me that work is the most detrimental thing to our health that we know of. So there's standing desks. dancing in the car at a stoplight. So I guess that's just kind of doing this. And that is good practice for, going dancing during the weekend, which I will talk about maybe a little later. You can have movement alarms. Bzz, bzz. Oh, got to stand up. Stretch. Wheelchair users' ideas. You can do isometrics. You can, press against your arms or against an arm in the chair, which you cannot see. Just shifting your weight back and forth, what we used to call fidgeting. There are some standing frames or just moving your arms and trunks. So just remember, everything counts. Mandy, is there anything you'd like to just add to that before you move on?
I just like that. I just like how you said that, Alex. Everything counts. So putting the clothes away, doing household chores, picking up after your children, all of that counts. So keep that in mind when you're thinking of that 150 minutes. Maybe you're already doing more than you realize you're doing, right?
Very good. And now this whole concept of physical activity leads right into what's really a hot topic in research right now, and that is using physical activity to combat against a sedentary lifestyle. So a lot of people are starting to consider sitting as really the new smoking. And I read somewhere now from an Australian study that watching an hour of TV, if you're sitting, is the same as smoking 2 cigarettes. So maybe sitting really is the new smoking. And we're starting to think of being sedentary as being different from not getting exercise. So being sedentary is an additional set of risks that exercising twice a week or 3 times a week does not necessarily help against. So a sedentary lifestyle can contribute to risks for cancers, cardiovascular disease, the whole list that we've been talking about, type 2 diabetes. In addition, low back and neck pain, it's also associated with all-cause mortality or a shortened lifespan. So standing alone, and to be honest, we don't know whether it's sitting or a sedentary lifestyle, but we use sitting as a model for being sedentary. So just standing alone requires some muscle contraction from your lower legs, or if you're using your arms to get up. So standing may help reduce these risks and help improve bone health, muscle tone, posture, as well as mental alertness. There's evidence it can reduce what I call symptomatic fatigue, or the fatigue of MS, as opposed to the fatigue of exercise, and it can burn more calories. So in addition to getting exercise, we have to consider trying not to be sedentary. And again, this feeds into the concept that really everything counts.
So you have our permission to get up and move around during this webinar, right?
Oh, thank you. I'll do this again.
So hopefully we've convinced you that it is possible for you to get your 150. How are you going to get your 150 using exercise? How are you going to get your 150 using physical activity? But we also have to be realistic. So there are barriers. There are barriers that are very real and very hard for people living with MS. Lack of time, access to facilities or equipment, fear of falling. This is a common one. That fear of falling can limit interest. It can limit your ability to want to move because you're fearful of your balance. No support to exercise or an exercise partner. It's always nice to have someone kind of nudge you along or help you, keep you accountable. Fatigue, MS fatigue is probably the biggest barrier I hear about as far as remaining consistent with exercise and physical activity. Self-conscious, transportation, getting to and from the gym or having good access to equipment. Knowledge of the exercises to complete. You know, the name of this webinar was about, referred to an unfamiliar body. So I think sometimes when people's bodies feel so different because they're experiencing this disease, suddenly the ways they used to exercise or things that felt comfortable before suddenly feels much differently, a lot different actually. So that knowledge and how to incorporate exercise is important. And lastly, symptoms. So all of these can be really impactful. But we're going to use the last little stretch of our webinar time that we have to talk through some scenarios. So we'll go through these fairly quickly. These are things Alex and I have heard over the years working with people who have MS. With work, my kids, and my spouse, I do not have enough time in the day to exercise. Very, very real. This is a significant barrier. So what are some things that someone could do to help manage this barrier of time? So intermittent exercise or movement. So Alex kind of alluded to this, how you can sprinkle your exercise and physical activity throughout the day. You know, I tell patients, maybe after you go to the bathroom and you're washing your hands, you do 10 body squats for strengthening your legs. Or maybe while your morning coffee's brewing, you decide to do planks to get a little bit stronger and work your core, trying to use those little periods of time that you have for some constructed movement. Scheduling exercise, you know, if it goes in the calendar and you tell everyone this is my time to exercise, you protect that time, that can help you find that time to exercise. And this kind of leads into prioritizing exercise. Like, none of us are going to find more time in the day. And we know that exercise and physical activity is so important. It's important to make it a priority, just like you would prioritize taking your medications or prioritize time with family or friends. And then lastly, incorporating it into a routine. The example I like to use with this one is I have patients who would prefer to exercise in the morning. And I had a gal who wore her exercise clothes to bed the night before, and it was a trigger and a motivator, and it was part of her routine to get her up and get her out of bed to exercise the next day. So think of ways to make it a routine. The next one is, after work, I am simply too fatigued to exercise. So that barrier of MS fatigue, huge. So I want to talk about this by starting to distinguish between primary fatigue versus secondary fatigue. So primary fatigue is that fatigue that's related to demyelination and to that decreased nerve conduction that you get as a result of the disease process itself. Whereas secondary fatigue is more related to perhaps poor sleep or insufficient nutrition, or maybe deconditioning, or other health conditions like maybe thyroid issues or other things that need to be managed. But distinguishing what is the source of your fatigue and doing a little bit of investigation again and detective work can help you manage fatigue. Secondly is this concept of 4 Ps of fatigue management. Now, you could go on Can Do MS's website and watch whole webinars about fatigue management by our fabulous team of occupational therapists. And occupational therapists are kind of the experts or the gurus for fatigue management. But they talk a lot about something called the 4 Ps. Planning, so organizing your day and your schedule to make exercise and physical activity a priority. Pacing, so Alex spoke about, again, if 30 minutes is too much, or if doing all of your sets and repetitions of your strength training is too much at one time, pacing yourself intermittently can be helpful. That's a way to manage fatigue. Prioritizing, again, prioritizing what's important to you, and that might be if it's important to you to make that exercise class after work, then how can the earlier part of your day be reorganized and rearranged to allow you to optimize your energy for that activity that's a priority. And lastly, positioning. Again, there are times you just need to conserve energy for those more important tasks. So thinking about sitting or positioning yourself in a more energy efficient way to allow you to budget that energy for other more advantageous activities such as exercise and physical activity.
Thank you, Mandy. So one of the things that you and I have heard a lot is that, you know, people go, oh, I can't exercise like I used to. And this is kind of a downer, so we might as well not exercise at all. When I don't want to oversimplify it, but there is perhaps there's no need to take this approach. And sometimes you just need a little motivation. And one of the things that I did not mention when we talked about physical function earlier is that there's a body of literature that shows that regular physical activity can improve sexual function. Okay, did you see Mandy blush? I had to throw that in. Anyway, so if that's not motivation to start exercising, then I don't know what is. But I think the key thing here is you need to be willing to consider different options. So if you used to ride a bicycle, well, maybe consider riding on a tandem cycle. Maybe there are other exercise options that that you're just not aware of. Try something new. I like to emphasize finding something that's fun. And if it's fun, then you're more likely to do it. And by doing something new, this also contributes to your overall well-being, this concept of wellness. So you're challenging yourself. If I go back to the exercise, the bike example, I took part in a NMS charity ride at the Bike MS event last month, and there were 20 people on my team that were riding that had MS. And some of the people I wouldn't have known they had MS unless I talked to them. Other people were riding with arm cranking bikes. Some were riding with arm cranking leg in tandem. I saw one woman rode in tandem with her husband, and it was all across the board. So there are alternatives for fun exercise that would be similar to what you used to do, or just try something new. In the physical activity realm, we have, I mentioned dancing in the car earlier as preparation for the weekend. My lab group has actually looked at partnered social dance and found that there is improved balance, endurance, and believe it or not, cognition. So that was kind of surprising for us initially, but we've seen it twice. There's also been similar results that's been shown in salsa dance by another excellent laboratory. So find something fun, and the physical activity is really wherever you find it. Remember, exercise is medicine. So consider exercise just like taking a pill. Think of it as a therapeutic ritual, and you need to try and incorporate it into your lifestyle.
So the last quote to talk about barriers is, I get too overheated when I exercise. So what are some of the barrier breakers or cooling strategies that people can use to help allow them to continue participating in exercise and physical activity? Some suggestions are pre or post-exercise cooling, and I actually find this really effective in the physical therapy office. So we use a lot of the cooling devices, and I'm jumping ahead. So the devices that you can wear around your neck, they're like a cooling wrap. They have vests. You can see in the image there's one that goes around the waist like a belt. And even for our women, there are cooling products that can be inserted in your bras to help keep you cooler as well. Some of the literature suggests that as little as 1/10 of a degree can help to improve exercise performance and reduce symptoms that can exacerbate as a result of an elevated core temperature. So do not underestimate the importance of cooling strategies, cold beverages, cooling devices, and simply exercising in a colder environment. Two resources might be an organization called Polar Products. You can go online and check them out. I also have some patients who like devices called Frog Togs is another cooling resource, but use those cooling products to help you and others. So I kind of want to end with this final few thoughts. That we acknowledge that consistency with exercise and physical activity is hard. And it's almost like a pendulum where you go through periods where you're really engaged, really excited, like kind of how you feel after this webinar. You're really ready to take on the world and participate. But then, things can happen. Maybe you have a really busy week at work, family commitments become overwhelming, maybe you're having a flare-up of your disease. Something causes you to become less engaged or disengaged. So there's this kind of flux back and forth. We acknowledge that, we realize that's normal, but we want you to remember your team. Remember folks like Alex and I. Remember people and organizations that can do multiple sclerosis, the National MS Society, MSA, your healthcare team, that can help pull you from that period of disengagement and help you re-engage and re-participate in the exercises and physical activities that help you be the best person that you can be. So we'll leave you with this thought. How will you get your 150? But hopefully we can change that to how you can get your 150. And you can go home and use this circle and think about it as a pie and dividing it. I'm going to get 150, or I'm going to get 15 minutes a couple times a week with flexibility, and then maybe another 10 or 15 minutes with aerobic, and see how your pie, your 150, can shape out. But we wish you luck with achieving that goal. We'll pass the baton back to Brian for some questions.
All right. Thank you so much, Alex and Mandy, for sharing your expertise with us. I mean, look how many books are on your bookshelf behind you. You guys must be smart. Share your knowledge with us. We really appreciate your time and all your work for putting on this presentation this evening. We do have a few minutes for questions, but before I get to that, I do want to remind everyone that this is part 2 of a 3-part series. So hopefully you joined us last week. If you didn't, all of these 3 webinars will be on our website, able to stream on YouTube, and hopefully you can join us next week. Mandy will be back with a psychologist to talk about communication and all the different people that we need to communicate in our lives, and especially in this period of transition for a lot of us in this age group, that how important that is. So you're already registered once for the whole series, so hopefully we'll see you back here next week. And again, this will be archived on our website. And we went through a lot of different numbers and routines, and so that might have been overwhelming. In your panel right there, you'll see a PDF copy of tonight's slides, so you can print out all the slides and kind of keep track of the different areas of exercise and hopefully find something that works for you. So with that, we do have time for a few questions. We're not going to get to everyone, so I will tell you about other opportunities to submit questions. But as Mandy mentioned, the title of this webinar was "Staying Active in an Unfamiliar Body," and certainly MS creates oftentimes depression and other psychological symptoms that may make it hard to stay engaged. And so this first question actually comes from a support partner. We have a lot of support partners on the line. So how do you support loved ones to be active when they're going through some of these psychological symptoms? And how do you be a good support partner without being overbearing or insensitive? So any thoughts on that?
Do you want me to take a stab at this, Alex?
Please, thank you.
So I think it's often helpful if the support partner finds activities to do with the loved one who has MS. So we talked a lot about physical activity and how it doesn't have to be structured like exercises. So maybe it's going dancing and getting that person moving and more active. I don't want to say without them knowing, but in a way that they're doing something together, and then that's fostering and growing that relationship, and can be a way to also grow the opportunities to do physical activity together. So that would be something. And then I would also argue that if you're having trouble convincing and working with them, get your healthcare team involved, get a psychologist involved, get your PD involved, try to personalize and help people understand the true value.
Great advice. Thanks, Mandy.
If I can just jump in real quick. So if you're in the Milwaukee area, we're having a free ballroom dance for people with MS this Sunday at 6 o'clock.
There you go. And there's so many local offerings like that. And the National MS Society, the local chapters there are great resources for that. Alex, I want to direct this question to you. You talked about research regarding brain function improving with exercise. Any specific research that you know about the benefits that exercise may have with remyelination or helping with recovering from relapses? Anything,
Um,
anything more specific on that?
um, Not specifically. However, as I mentioned earlier, there's a growing body of literature that shows that exercise can kind of tip the balance between inflammation and anti-inflammation. And with respect to that, if there is less inflammation going on in the body, then there could be less damage due to the autoimmune attack on myelin. So in that sense, the exercise just kind of improves the background against which a lot of these other bad things can occur. That's not a specific answer, but I hope that covers a little bit of what
Yeah.
was asked.
I appreciate people are so interested in the latest research that's coming out. So and you're a great source for that. Mandy, I want to go back to you, and Alex, you can and certainly chime in too. We received a lot of questions that another barrier to exercise is that afterwards, so many people experience pain or spasms or cramps or burning sensations. Any tips for kind of dealing with those after exercise negative impacts that seems to be so common with people?
Right. So if your exercise aggravates symptoms to a point of extreme discomfort, I would reevaluate the exercise approach a little bit. But I would also bring attention to something we call the 2-hour rule, that if you do not feel as good 2 hours after exercise as you did before you started exercising or doing your physical activity, then you may have done too much. So I would also have these folks look into maybe are they doing too much, or is the approach that they're doing, could that be modified a little bit? Anything you want to add, Alex?
Yeah, just that it's going to require a little bit of trial and error. You'll need to I would probably start first off by decreasing the intensity. Again, it's highly individual, but you can adjust the intensity, frequency, duration, or type. So if you have access to a pool, maybe going into the water would have create less joint stress, which might contribute to pain. It just depends. So I'm afraid it's just going to require some trial and error and work with your rehab team um, or an exercise professional, and good luck.
Yeah, little detective work.
Yes, thank you. We're kind of coming to the end here. I do want to sneak in two more overtime questions, if that's all right. We got so many questions about insurance, and just real quick, Mandy, you mentioned that rehab is often a starting and an ending, but with PT specifically, if the insurance won't continue past a certain point, where do you typically recommend your clients to turn to?
Right. So depending upon who your insurance provider is, there are usually a restriction on the number of visits that you can have per year, or there is a restriction on the dollar amount for rehab that you can have each year. I think it starts, number one, with being educated on what your insurance plan allows and articulate that to your therapist so that your therapist can be aware of that, and maybe it's setting up rather than going twice a week for 8 weeks, you go to physical therapy once every other week so that you're able to disperse out your visits or your allotted dollar amounts over a longer period of time. But inevitably, there are certain circumstances where you just exhaust your resources, your therapy resources. And that's where it becomes important to find those trainers and those people in the community who can help you continue on with your exercise program outside of that. It's also really important, and it's kind of on the shoulders of the therapist to make sure that you have a home program that you can do independently and that is appropriate for you outside and beyond physical therapy. But in Nebraska, we have something called MS Forward, which It's an MS gym. They do in-person exercise programs, but then they also have online telehealth types of exercise. So you can log on and do exercises with a trainer who understands MS. There's also other nationwide organizations, and I'm forgetting off the top of my head, but I can email Brian, who can email the group. There's an MS Workouts, I believe, and then there's a group out of Colorado. I can't remember their name, but I can email Brian's. But there are lots of online MS exercise groups that can be a nice continuation outside of therapy.
Thank you so much. Last question. This is our young adult series, and feedback that we get from a lot of participants is that most of the resources and programs out there are sort of geared to older, more advanced disease states, and not a whole lot of programs for young people and resources for young people. Any recommendations or resources that you know of that are really geared to the younger demographic that may be missing in sort of the broader MS community?
I can start out. You might want to check with the National MS Society chapter, and first off, see if they have any young adults groups. In the Milwaukee area, we have a group, the Optimistics, and it's basically a social group for younger people with MS. So I don't know what the situation is in your area, and it could be that you're going to need to form your own group.
Yeah.
And Can Do MS, we are starting to develop a pretty significant amount of resources for our young adults as well. So hopefully we can be a resource for all of you as well.
That's a great plug and a great transition, Mandy. So thank you very much. And thank you, Alex and Mandy, again for your time. And thank you, everyone, for joining us this evening. We hope you found it valuable. And again, Mandy and Alex, thanks for staying up late overtime with us. Any closing remarks you'd like to say to our audience this evening?
We wish you well.
Yep. Good luck.
All right. Thank you, everyone. And we will see you next week. Have a good night.